as of today, we've had more than 170,000 doses delivered to New Mexico, and we've administered 78,143 doses. Within the last 7 days, we've administered more than 30,000 doses. And this, again, is based on 81% of providers reporting. So the good news is New Mexico has one of the highest administration rates in the country. Within the last 3 weeks, we've had nearly 400,000 New Mexicans to register for their vaccine. We encourage all of you to register. It is the way that you can get yourself in the queue, and then we can follow up with an appointment so that you can get your vaccine. You can modify your profiles at any time. And again, you will receive notification when vaccine is available at a nearby location. So I wanted to walk you through the phases for distributing the vaccine. So as you know, phase 1A was the phase we were in just before we opened up 1B. And 1A, just to reiterate, hospital personnel and personnel in congregate settings. And so we've now opened up 1B. And I want you to understand that we're starting with, in sequential order, persons 75 years of age or older, and then persons 16 or older with at least one chronic condition, and then persons who are frontline essential workers, followed by vulnerable populations. And I really want to encourage persons who are in 1A or 75 years of age or older to make sure you're registered so that we can move you to the front of the line and get your vaccine. Now, when we talk about sequential, what we're wanting to do is to reach as many as we can who are 75 or older, and then move to those who are 16 or older with at least one chronic condition. Those conditions can include cancer, chronic kidney disease, immunocompromised, asthma, obesity, or hypertension. What I just read there is not an exhaustive list, but it gives you an example of what we mean by a chronic condition. Please keep in mind that a substantial number of New Mexicans will meet eligibility based on that one group, being 16 or older with one chronic condition. We also have frontline essential workers who are key to keeping us functional. And that includes K through 12 educators or those who work in higher education who cannot work remotely, and grocery store workers. And again, we have a list that we've made available that includes frontline essential workers. As far as vulnerable populations, we're talking about shelters, about our youth, about detention centers, correctional facilities. These are vulnerable populations because these are people most likely to be infected who don't have the option of distancing themselves. And so they're more at risk for COVID and they're more at risk for dying. So we really have to be very efficient and strategic in getting them vaccinated as doses are available. After 1B, which we're looking at covering the winter through the spring, we'll move to 1C. And then after 1C, we'll move to phase 2, which is a general population.
Dr. Collins, and I apologize if you've covered this to any extent, do you sort of expect a steady stream of vaccination doses? Do you expect that to increase as production increases? And how far out do you know how much you're going to get? Thank you.
Yes, thank you, Matt. So we do expect currently a steady stream, but we're looking each day. And as we have a new administration coming in the door, we're hoping that that supply increases, but we will know more later. And so really the idea is to vaccinate as many people as we can and to reevaluate on an ongoing basis the doses we have and how many more people we can vaccinate.
The progress that New Mexico has made regarding vaccinations is truly remarkable. We're standing out in this country in a very positive way. We're excited to support the state Department of Health as they move through the next phase of vaccinations. We're encouraged by the number of healthcare workers who have stepped forward to receive the vaccine. To date, Presbyterian has administered over 11,000 doses. But the hope of the vaccine must be balanced with the reality that COVID-19 is still spreading in our community. Our state and local percent of positive COVID tests remains too high. as are hospitalizations and daily case counts too high. We must remain vigilant about protecting ourselves and those we love. While vaccine efforts do continue, we encourage New Mexicans to continue practicing COVID-safe behaviors, such as avoiding large gatherings and wearing masks properly over our noses and mouths when we're out in public anytime.
Here at Lovelace, as well as the rest of our health systems across the state, we're supporting the state in these efforts. And as already been mentioned, our state is doing really well. We're really moving in the right direction to be able to try and vaccinate as many people as possible, as quickly as possible. We've so far have done about 65% of our employees and want to continue with concentration on those high-risk groups. And now that we're in phase 1B.
So far, UNM has given in excess of 10,000 doses throughout our health system. We're still focused on healthcare workers who have direct patient interactions on a regular basis. Administrative staff or those who are working from home are now being encouraged to utilize the Department of Health website. We're not intending to do anything other than shift to utilizing the website for the rest of our employees.
We have seen some increased interest of people who originally said, I'm not sure about taking the vaccine and had some reluctance. And now that I think they have seen their colleagues take the vaccine without problems, we've had additional people sign up for their first doses. So now that the state has allowed us to move to 1B, we will be expanding what we're able to do. And so we're actively making plans to be able to move into our next level or next tier.
COVID count numbers may be coming down, but this is our high season. So overall hospitalization numbers are still quite high. For the second part with regards to morale, it was immediate boost in morale. People finally had hope that there was light at the end of the tunnel, that perhaps we could become more normal by the end of this year.
And again, I think the reduction in stress for people to feel that they have a measure of protection. Of course, they're still wearing PPE and doing all the appropriate things, but it's just an additional measure that gave them security. So I think it has helped. The numbers coming down has been helpful. I think people have seen how the community and state has pulled together and tried to make a huge effort to reduce those numbers. And so, we thank everyone for doing that, because that has been exceptionally helpful as well.
Yeah, I can't overemphasize the joy and relief that our workforce has had with the advent of the vaccination. And I think also starting to see that we're on what appears to be a downslope in terms of hospitalizations and the number of COVID cases occurring in our community. Those things combined have really boosted morale significantly and given our frontline workers the added juice to keep going forward. These are tough times, and our healthcare workforce has been working hard.